We cannot say yet that we have community transmission. What I know about that case is that was travel related. I think the likelihood of a community spread is very high because it's everywhere in the country.
That was the reaction today following the confirmation of the Valley's first COVID-19 infection. Area doctors now bracing for the likelihood of more cases now that more people are getting tested. Experts also emphasizing the importance of good hygiene and practicing social distance. But what about the non-medical advice available online? Channel 5's Taylor Winkle sat down with the doctor today at Valley Baptist in Harlingen.
This is where that initial patient was diagnosed, and tonight, as some worry about the spread of the virus through the valley, we asked a doctor to separate fact from fiction. With one travel-related case so far, what's the most important thing you should know about coronavirus?
The form in which you are more likely to get it will be either because you touch a surface or shake a hand from someone who had the virus on their hands and put it on your face or your nose, or because someone sneezing or coughing was very close to you, usually for a prolonged time.
That means to prevent the possibility of getting it yourself, wash your hands and stay at least 6 feet away from others. How long can the virus last on a surface? It depends.
It can be a couple of hours, or it can be, in some surfaces, it can be days.
The surface material and level of exposure make a difference. That's why it's recommended frequently touched surfaces like door handles and cell phones are cleaned regularly. How long can the virus stay airborne? That depends on the environment. Outdoors, it's less likely to settle because of wind and other elements. Maybe you've heard people in warmer climates are less susceptible. That's not true.
We don't know that. We think that people can get it in any climate.
The virus is transferred through people and stays alive on your body because it has a regulated temperature. If you think you are infected, can daily medications or over-the-counter painkillers like ibuprofen make your symptoms worse?
Any medication that you use can cause adverse reactions. What I will advise is that if you're going to be taking medications over the counter or medications in general, it should be with the advice of your healthcare provider.
That minimizes the risk of complications. That doesn't mean stop taking your medications. You need to control underlying health issues like diabetes or blood pressure. It means you should talk to your doctor. While the importance of washing your hands is factual, washing them with extra hot water can, in the long run, put you in greater danger of contracting diseases because it weakens your skin and gives you open wounds. Soap and regular temperature water is just fine. More facts can be found online at krgv.com after the newscast. If you feel you need to go to the doctor, it's important you don't just show up to an emergency room. Call beforehand and get additional instructions of where you should go so you don't put other patients or healthcare providers at risk. Doctors say right now, if you are feeling a sickness, it's likely due to a different virus, not COVID-19, but that may change over time. Reporting in Harlingen tonight, I'm Taylor Winkle, Channel 5 News at 10.